Hello, YouTube family. So today, as we said, in this channel, it's all about preventative measures. And joined today is Mr. Alan Coy. And remember, today as we talk about preventative care, here in Joska, there's a very nice, good hospital called Imaniako. Mr. Alan, have you heard about Imaniako?
Yeah, I've heard about the best services that Imaniako is offering for the people, to the people in Josk, and asking very few people within, they said yes, the services are high notch, and they're referring more and more people. So if you're there and you're in Joska and you're looking for a place to get the best health services ever, the place to go is Imaniako. There's no another place rather than Imaniako to give you whatever you're looking for.
Did people tell you about their prices?
Yeah, they said they're more pocket friendly. With the Kenyan context, your same man is price is a hustler. So whenever you go there, and in fact, they said the guys who work there are giving a very understanding. Like they can never ever let you go before they work on you. And even if you don't have enough, they will still understand and find out a more probable way of trying to pay the bills and all that for you. Nice. Is it so?
Yeah, I've had that. So
are you one of the people who work there?
Yes. Remember.
So it's you, they say that. Because they said there's another lady there, brown. Her name is Mercy. It's you.
Definitely. So remember, all about preventative measures. So when you come to us, we give you the best. And also when you call at Mobile Doctor Kenya, we also give you the best. We don't compromise when it comes to health.
Of course, we don't have to compromise, because when you're dealing with the human life, you have to be very much specific with what you're giving. And that is why we trust Imaniako for that information. Like they will never give you a misleading information, but they'll give you factual information to help you come out of what you're talking about. Now, talking about preventative care to each and every individual, and this is not only for Kenyans, this is for the whole world. So wherever you are, if you can hear English, okay, even on YouTube nowadays there is a translator, so if you can't hear English, so sure our articulation of this word is saying is high notch and on point, so you can translate to any other language and you get to understand. Talking about hepatitis B. What is hepatitis B?
Today, remember, that's a hot topic. Thank you for asking me about hepatitis B. So hepatitis B is a viral infection, and it affects the liver. Yeah, so it makes the liver inflame, and with that it can make the liver fail, or you get cancer.
Cancer of the liver?
Yes.
There is a cancer of the liver?
Yes, you can get a liver cancer.
But we rarely hear that.
You've heard about the liver failing.
Sure.
The one we call in medical terms cirrhosis.
Yes.
Then
liver cirrhosis.
Yes. Then there is now the cancer of the liver.
So how does it look like? Because I've never seen of liver cirrhosis. I've heard of those cases. Liver inflammation, I've heard of those cases. But when you talk about liver cancer.
So liver cancer, as we said, when it can either fail or you get cancer. Now, cancerous cell, it's because when it starts inflaming,
sure,
the cells start changing. And you know, in our body, the same way you can scar. When you get either burnt, like I got a burn here last 3 days ago, but it's now healing. But it has not healed like the way
it should
be. It's not as the same as the skin how it was. So that is scarring. With that scarring, cell tends to change, and now that's how we tend to get cancer.
So what she's trying to say in simple terms, cancer or cancerous cells are just a normal deformed cell, deformed in a different way, like not in the normal way, but now deformed in a very different way and scary way. That is what we call cancer, a deformation of normal cells into something different that you might not tell. But for the doctors, they'll be able to tell you this type of cancer, and all that. So if it happens that way, then I think we should be very much careful about hepatitis B.
Yeah, very careful.
And how is it transmitted?
Okay, hepatitis B can be transmitted through different ways. Fluids, that is either you're sharing equipment and the fluid from blood okay, in hospital you say medical equipment, but also remember out there we have spas.
Sure.
And I'm not here to say that don't go to the spa. Just ensure the spa you're going to is licensed and they're professional working there, so that they are disinfecting their equipment. Like for ladies, you go for manicure, you go for pedicure, or they use even for you guys massage, you go
massage.
Yeah. And we go to the salon, you go to the barber shop, but how well are the equipment sterilized from one person to another, okay? Or between one person to another, so they can carry simple or little amount of infected blood, and that can also transmit to you if you have an open wound. So we need to be very careful. Also, it's transmitted through mother to child, through delivery. Any place you're coming into contact with fluid,
blood.
yeah, you can either type of fluid, mostly you can get.
When you talk about either type of fluid, you mean even with tears, sweat, you can get
it, but at a minimum. It's when most of the time blood has a higher carriage, but for the rest is tiny. So unless you're coming up with a very higher dose.
Okay. So we should be very much careful again when coming into contact with that, and I think it's more of an individual initiative for you to try to understand that or try to make your environment so clean, because you're taking care of your own health. And we said if you have good health, we have wealth. You can have all the wealth that you're looking for, but if you have poor health, the wealth that you have will be used to maintain your health. But if you have a good health with the little that you have, you still live as a happy person and all that. So what are some of the ways through which we can prevent hepatitis B from getting hepatitis B?
As we said, depending on where you're going, like if you're a healthcare worker, because for us we are usually at a high risk of getting it. So we need to be gloved in any time we are attending to patients. So when you see that you have come to the hospital and a healthcare worker is taking time to put on gloves, remember they are trying to protect you and also themselves, because I can be having it and I also want to protect you. So don't feel mad when I'm taking my time to put on the gloves, okay? Then number 2, sharing equipment. Like when we go to as we said, most of the time we're using lasers at the barber shops, the equipment we use to shave, and we're also going for manicure to make ourselves look good. We're going for ear piercing, we're going for tattoo, we're going for pedicure.
Nowadays you're even changing some parts of your body because you don't like yourself
definitely the way you are. The surgical. So we need to be very careful. Let's always check, are we at the place licensed? Are there professionals working there? Are the equipment well sterilized? Because it's good to ask, or if you can even carry yours, it's also good.
Yeah, you carry your own.
You can carry your own pedicure and manicure.
You do it in your own house.
Maybe if you don't have the capability or the know-how, you can carry yours.
Why did you buy it if you don't know how to use it?
Because you want to protect yourself.
How do you buy a car when you can't drive it?
Sometimes you can hire a driver when you need your comfort.
Then hire that person to come to your home. Don't bring those stuff on my.
Then ensure that they are well sterilized.
Okay, so safety, it's just good for us. And when you get yourself to the hospital, the thing that you should completely look out for, and one is the hygiene of the hospital. How clean is the hospital? And number 2, even the people who are there, who are serving you or giving you the services, how clean are they? And number 3, no nurse, no doctor should handle you without gloves. Not at any point. If they are coming with a needle and they want to give you services and they are not wearing gloves, kindly send them back. It's your right. It's your right to send them back to go and wear gloves. You simply tell them, you need to protect yourself because you don't know what I have and I don't know what you have. And it's just good for us to be protected in one or the other. So those are some of the things that you should look into before you receive those services in the hospital. Definitely. I think that's what you just said.
Yeah. And also when going to a spa or when going to a barber shop or a salon, ensure that the equipments are well sterilized. If you cannot see them being neat or being disinfected, ensure that you ask or request for them to be disinfected, because I've seen in various spas whereby you have different clients and the equipment is moving from one client to the other. So in between, it needs to be disinfected. So ensure that is done. And be careful, because you can get hepatitis B just because you just wanted to pay 1,000 to get beautiful. And it has no cure, by the way. We just control.
Of course, that's what the next thing I wanted to ask you. What's the treatment of hepatitis B?
It's just controlling.
So it's maintaining.
Just controlling so that it cannot develop to a later complication, to either cirrhosis or to cancer. Yeah.
So hepatitis B doesn't have
A cure.
but
Yeah.
it has a vaccination.
It has a vaccination, so it's good to be vaccinated. You remember the shots or the jab that kids
Are given when they're young.
Yes,
Yeah.
it contains. But you can also get a hepatitis B if you are working in high risk areas, like hospitals, like those spas we are talking about, or any place you are working whereby you are coming into contact with body fluids and such. Yeah.
And that is, you said about every body fluid that we can talk
Yeah.
about, but the blood has the higher percentage of
Yes.
the same. So,
And also practicing safe sex.
So you can also get it through sex.
Yeah, definitely. You're sharing fluids.
Utafanya watu waanze kumwaga nje. It's okay. Sorry.
Even if you do that, you'll still get it if you're not protecting yourself.
The doctors will call it coitus interruptus. That is in a family planning thing. So that is the information that you guys are looking for. And as we give you the information, the factual information, like you can Google and still see that what you're telling you is very true. So you don't need to doubt what you're telling you. We can't come here to tell you things that we are not so sure about. And you can help us. Very simple. You need to get all this information back to each and every time. We're kind of requesting you to support us. And the only support we're looking for is for your simple subscription. And once you've subscribed, make sure you hit the notification bell. That is when you'll be getting everything that we're putting up there for you. We're not asking you for money or donations. It's just a very simple and free subscription. That is all we're asking for you. And you can share this information to the rest of the people around you, or you can watch it as a family because it's clean. Yes, it's rated general viewing. No parental guidance is needed.
So remember, when if you have any query, remember to ask down below. You ask on the comment section, we'll be sure to answer you, because we want you to get prevented from all the diseases that are out there. And if you want us to talk about any other topic, write it down below.
And remember, the mobile clinic, again, it's there for your sake. Those emergencies that you don't want to talk about, you don't know how to reach, or you don't know who to call for a solution, they are available. And you just leave your comment once you've joined the group. It's just on WhatsApp, down on the status. There are those groups. You search for
mobile doctor _ Kenya. And if you're along Kangundo Road, don't go far. Imani yako will sort you.
You see how everything is available for you. Like, you don't need to suffer. And I know there are those confidential cases, by the way. Like, most of the sexually transmitted infections are more confidential. People don't just talk about it publicly. Yeah, because they are afraid. Maybe ilikuwa ni mpango wa kando and hataki wife ajue. But again, yes, remember. But again, you know, the danger of that is this, by the way, because in all these things you need a support. Like for the hepatitis B, because you just it has no cure.
It's a long life.
Yeah, it's a lifelong. HIV is a lifelong. It doesn't have a cure. So in such a kind of illnesses, some ailments, you need someone to give you support.
Definitely.
So as much as you cheated on your husband or your wife and you got it, you need a support system that can support you into that, because taking care of it and maintaining it, or taking medication for that, is something that is so tedious. So as she said earlier, you know, as we always say on our preventative talks, we say having one faithful partner is being faithful to one sexual partner is the goal for you to prevent yourself from getting unwanted infections. Okay, I'll call them unwanted infections because you look for them, they don't look for you. Unless of the cases of defilement and rape, they came for you. But if it's not defilement, it's not rape, then you went for them.
And remember, at Mobile Doctor Kenya, we have a rape kit. A rape kit, we give services, they are packages. So when it happens, because you can go for their code bash.
Sure.
Yeah, you can go to any occasion and it happens to you, especially when you get disoriented because of either alcohol or drugs that you might use, remember, if it happens to you, call us. We'll come to you. Remember, we are mobile doctor. We'll either come to you or you can consult us. So don't feel afraid that we are going to breach the confidentiality. So ensure that you call us anytime, any day. We will be there for you. And again, if you're along Kangundo Road, at Imani Yako, we got you.
Thank you so much. Same place, same time. Please don't switch the dial. Remain here and we have the information for you. So please leave your subscription and leave your comment. What would you want us to talk about next?
Bye.